The next procedure that we're going to talk about is sterile gloving. So for this procedure, we're going to need a pair of sterile gloves that fit us. As I entered the room, I of course did my hand hygiene. The next thing I'll do is, if I'm ready to apply my sterile gloves, I will open my package. My sterile gloves come in their own little envelope, and I'm going to unfold the envelope, and then I will unfold it again, and I'm going to lay it on my surface, my nice clean surface, ensuring that the area where I'm applying the gloves is at my waist level, and sterile gloves should not be applied on a patient's bed, whether that be on the patient's chest, at the foot, or the head of their bed. Once I have my gloves opened, I'm going to open the top and the bottom flap very gently. And then I have two flaps here where I'm going to put my fingers in there and pull them open. As I'm pulling this open, I'm going to do what we call tenting, which is where I'm going to kind of make a little triangle here to kind of prevent this sterile packaging from folding back over onto the sterile gloves. If the package were to fold back over, I've touched this, which means that now this is no longer sterile. This is our 1-inch border, right? And so if our 1-inch border folds over and touches the gloves are no longer sterile. Okay? All right, so once my package is open, I'm going to go ahead and start by picking up the glove for my dominant hand. So we'll say my dominant hand is my right. I'm going to pick that glove up with my non-dominant hand. I'm going to pick that glove up by the cuff. I want to ensure that I'm not touching anywhere on the sterile field, right? So when I'm picking it up at the cuff, right? In the middle of that cuff. That cuff is no longer sterile. I'm going to step back and I'm going to use both my hands to kind of open the glove up. Again, I'm touching the cuff, which is now considered non-sterile. And then once I get the cuff open, I'm going to take my dominant hand and place it in the glove as I'm pulling the cuff back towards my wrist. Okay, and I just want to make sure that I'm not touching anything above the wrist. Now, once I have my dominant hand on, I'm going to take my non-dominant hand and I'm going to hold my sterile field so that I can take this hand, take my glove, my other sterile glove that's on my field, and I'm going to turn it. And I'm going to try to get this hand underneath that cuff. So if it's a little sticky, that's okay, because I can kind of mess around with it. And so what I'm doing is I'm putting my hand in this cuff and I'm kind of just pushing it down. I want to get it as down as far as possible and then kind of open my fingers up. I'm going to go ahead and dispose of this so it's not in my way. I like to do that with my non-sterile hand and just put it in my trash. Now at this point, my thumb needs to come up. Once this hand comes towards the glove, this cuff is going to be considered non-sterile. So as my hand is going into this glove, this thumb has to be up, or now this glove is contaminated. Okay, so thumb up as I'm putting this hand into the glove. And again, I'm doing that very gently. And now I have both of my sterile gloves on. Please be sure that when you're applying sterile gloves that you are doing it with gloves that fit you appropriately, as well as on a surface that is waist level and is clean.